Hi, I'm Dr. Sherry Berger here for Holohan's Hot Topics this week. I'm with Dr. Melissa Holohan. Hey, Dr. Holohan, what's happening in the world of emergency and critical care?
Hi, Sherry. So this week, what I chose for the hot topic is an article out of the Journal of Veterinary Emergency Critical Care discussing the diagnostic accuracy of the SNAP test and the SPEC canine pancreatic lipase test, which is also clinically known as the lab test, for pancreatitis in dogs presenting with clinical signs of acute abdominal disease. So, a little background on this journal article. Acute pancreatitis is certainly an important disease in dogs. However, the difficulty is in diagnosing pancreatitis, as many of the clinical signs are nonspecific. We're usually going to see abdominal pain, vomiting, diarrhea are the most common signs, but as you know, many diseases can mimic those clinical signs. Traditionally, some of the diagnostic methods we use to diagnose pancreatitis had very poor sensitivity and specificities, and those were mainly the lipase and amylase. And most of the research that you'll read says those are about 50%, so no better really than flipping a coin in diagnosis. However, the true diagnostic accuracy of many of these tests in determining pancreatitis is difficult, and that's mainly because the gold standard for diagnosis is still called into question because a lot of the testing that's been done is compared to histopathology. And since many people believe that pancreatitis can be a very focal disease, um, some believe that histopathology isn't even going to be an accurate gold standard. So this journal was actually looking at the two most common methods that we use now today in clinical diagnostic accuracy, looking at dogs with acute abdominal disease, so just non-specific abdominal disease coming in the door to your clinic. And then as a secondary objective, they wanted to know if there was a good agreement between the two tests. Most of the time, people are going to say you want to do a SNAP test in-house. That's usually going to be positive if the level's above 200. And then as a follow-up test for more diagnostic accuracy, you may send out the the SPEC CPL to the lab to get a definitive diagnosis. So this particular journal article looked at 38 total dogs that were client-owned, presenting with acute abdominal pain that had a known final diagnosis. This study was a retrospective study, however, though, and in this study they looked at two different groups, and the groups were assigned by two boarded criticalists and one boarded internist into a category of acute pancreatitis or a category of without acute pancreatitis. Interventions included paired serum samples. These were taken within 24 hours of presentation, and they were analyzed with both using the SNAP CPL test and the SPEC CPL assay. So the main results of this study were looking at the SNAP CPL having a sensitivity of 82% and a specificity of 59%. The SPEC CPL having a sensitivity of about 70% and a specificity of 77%, and then an overall accuracy in diagnosis of pancreatitis looking at about 66 to 75%, depending on which test you were looking at. So overall, in conclusion with this study, they actually found that the SNAP and the SPEC CPL test had a little lower sensitivity and specificity than the original studies that were published looking at these two tests. And they actually went on to comment that they may provide some false positive diagnosis of pancreatitis in up to actually 40% of dogs. And again, these were the dogs that were presenting with an acute abdominal disease. Although there was good overall agreement between the two tests, there were 4 dogs out of the 38 dogs that had a positive SNAP test, but then when the test was sent out for follow-up, they had a normal SPEC CPL test. However, this could be it's common that you could see this because the SNAP CPL test, remember, is a positive of greater than 200, whereas typically your SPEC CPL is going to be greater than 400. So there may be a little bit of gray area there where you may have not have a confirmed diagnosis of pancreatitis. And the final conclusion was that the positive SNAP CPL or the SPEC CPL may not indicate true pancreatitis, but may just be looking at pancreatic inflammation. And any disease that may cause secondary inflammation of the pancreas or hypoperfusion of the pancreas, may lead to a falsely elevated SNAP or falsely elevated SPECT test. And so I think that the main takeaway point that I take from this test, and that we all know as clinicians, is that you can't rely on just one test for clinical diagnosis. And although the SNAP and the SPECT CPL test stand alone as at this point to date, the most clinically sensitive and specific test for diagnosing pancreatitis, we're still going to be using those tests as clinicians in conjunction with other diagnostics. And probably the most common ones that we would see would be abdominal ultrasound, and obviously your clinical history and your physical exam. So that's it this week on Holohan's Hot Topics.